Ali, good evening to you. So the conventional wisdom here, the first jabs early next week, is all of that on track?
It looks that way, Jeremy. We do expect that the first jabs into people's arms will take place on Tuesday of next week. That looks to be the time frame at the moment. Where we've got to right now is that the first doses, the first batch of doses have arrived in the UK and have been distributed around various regions of the UK. There are going to be around 50 hubs at first, places, mainly hospitals, that the jabs can be administered to the first patients. In terms of how many people that may be, the government still saying that it hopes that around 800,000 doses in the first batch will be in the UK by next week. It had said that it hoped 10 million doses would be in the UK by the end of the year. It's scaling back that ambition a little bit because of some production problems that Pfizer has been having in Belgium, but the UK government still saying it hopes to have millions of doses in Britain for use by the end of the year.
And all of this accompanied, I understand, by a marketing campaign. What does that look like? And also, I'm assuming there would be security protocols around the queuing up and the distribution of these vaccines.
Certainly there are security considerations in place. This is incredibly precious cargo that is now being distributed around the United Kingdom. It also poses those challenges of distribution in terms of the very low temperatures at which this vaccine has to be stored. So that is part of those considerations as well in terms of logistics. And what we understand is going to happen is that people will start to hear from the National Health Service, from their local doctors, that they're being offered a slot for vaccination next week, and then people will turn up as directed. You can't just turn up hoping that you're one of the people that qualifies for a vaccine. So there's all of that to go through now in terms of how this all rolls out. And the PR campaign is very much underway. Yesterday we had Jonathan Van Tam, the Deputy Chief Medical Officer, out across the airwaves here in the UK. Newspaper interviews, television, radio, online. He's considered to be one of the government's most trusted communicators. So that's why he was used on day one. And today we've also had lots of interviews being done by the head of the MHRA, the regulator that approved this jab in the first place. That was always going to happen, this PR campaign, to try and make sure as many people take the vaccine as possible. But it was slightly given extra impetus by some criticisms of the UK regulator that seemed to be coming from the EMA, the European equivalent, and also from Dr. Fauci, the United States medical boss. And that has led to a bit of a pushback today from Downing Street, insisting that the MHRA here in the UK is entirely independent from governmental influence and has gone through all the safety procedures and protocols. It's just done so, says the UK government, more quickly than has been the case in other countries, in other jurisdictions.
How has the qualification criteria been worked out?
So there's a special committee that's been working through who should go first, and what it effectively says is that age is the thing that really makes a huge difference in terms of vulnerability to COVID-19, and so effectively we will be starting with the oldest people in the country, and then you come down the priority list in terms of how old you are. The first wave of vaccinations will purely be targeted at people over 50, but it's those people over 80 who get the very first spaces in the queue. Also prioritised are care home residents, even though there are some logistics difficulties with getting these batches into care homes, and also people who work in the National Health Service as well, those healthcare workers who are obviously on the front lines of COVID-19, right up at the top of the list as well. There are people who are vulnerable because of other clinical medical conditions who are close to the top of the list, but age appears to be the number one factor for this first wave of vaccinations.
The difficulty, I imagine, is going to be balancing the euphoria that the vaccine has finally arrived with the increasing cases that exist.
Absolutely right. And while cases in terms of daily numbers continue to fall, we've just had again data suggesting the reproduction number is falling still, is below 1. So that means the outbreak is shrinking in the UK rather than growing, and certainly not growing exponentially. The government is really worried about the public relaxing their guard now that the vaccine is here. Quite literally, it is here on British shores. So we've been hearing from the Prime Minister, but also government ministers and medical officers and the scientists that advise the government, really urging people to continue to follow the rules that are in place, not to lower their guards because the vaccine is coming. It's been pointed out that even if you were the first person in Britain to be vaccinated next week, you would need a second dose 3 weeks after that, and you might not be fully protected from the vaccine, by the vaccine, excuse me, until a week or so, 10 days, 12 days after that. So it is certainly going to take some time before the effects of the vaccine are felt here in the UK in terms of the wider impact. And that's why we're continuing to hear reiterated those pleas from government officials that people continue to follow the rules.
Yeah, that is so important. Ollie Barrett in London, thank you very much indeed.